It is Wednesday, October 1st, and effective today, Medicare will not be covering telehealth services. But please note that behavioral health services go by different guidelines, so that is still covered. We have no information as to, is this permanent? Is this temporary? How long is this going to be going on for? We do not know. There's a lot of unanswered questions at this time. For example, will you get paid retroactively? So say, for example, you have patients on your schedule today, you see them, you bill them, and then next week, telehealth is covered again. Will you get paid for today's date of service? We do not know. Another big question is Medicare Advantage plans. Does this apply to them? I think the assumption should be yes. Medicare Advantage plans generally go by Medicare guidelines. So unless that specific company makes a big announcement that they're covering telehealth for Medicare Advantage patients, I would be very cautious. If you just kind of bill it and see what happens and see, oh yeah, they did pay it, I'm going to continue to see all patients with this Medicare Advantage plan because they paid it in the past. Be careful. Remember that clawbacks are very much a thing. Just because they pay it doesn't mean that they can't take it back. If you are calling to ask about this, I would be very specific that you're asking, is telehealth covered using place of service 10, where the patient is in their home? The reason I say this, and it's complicated, of course it's complicated. Medical nutrition therapy technically is covered via telehealth, but the patient has to go to an originating site. And there's a lot of rules about that. They have to be in a rural area, and there's a very specific definition of being in a rural area, and it's kind of difficult to meet that criteria. And then the patient would have to go to like a skilled nursing facility or a hospital or a place like that. So when you ask to check benefits, they might be confused and they might say like, oh yeah, telehealth is covered if the patient goes to an originating site. I would assume that providers do have the option of having their patients pay out of pocket. Make sure you have them sign an ABN. And I would be very careful when filling out the ABN, say that Medicare does not cover telehealth at this time when the patient is in their home. So I would just be very explicit about that in case you have any problems later. Is this affecting you? Do you have a lot of Medicare patients that you're seeing via telehealth? Tell us your story in the comments below.